Have you ever wondered if some types of dementia are hereditary? Or how is dementia different from Alzheimer's disease? Despite the fact that today, over 24,000 people, right here in Ottawa and Renfrew County, are living with dementia, there is still a lot of confusion. Often we think of disorders and diseases as having specific causes, like how a streptococcus bacteria can give us a sore throat. But dementia is not a disease with a specific cause. It isn't even just one illness. It is a term to categorize a number of progressive brain diseases, including Alzheimer's and Parkinson's disease, and vascular dementia, that can each affect different parts of the brain. Since different parts of your brain are responsible for different functions, the way dementia affects people living with it varies depending on the type of dementia. So think of dementia as a disorder without one single cause and an umbrella term for many conditions. What is common among different types of dementia is the gradual impairment of memory, cognitive ability, behavior, and ability to complete activities of daily living. Depending on the type of dementia, these changes can either progress gradually or in sudden steps. So that's what dementia is, but how does it happen? A person's brain contains about 100 billion neurons. After the age of 29, we each lose around 20 million brain cells a year. That means between the ages of 20 and 90, we lose about 10% of our brain mass. Simple forgetfulness, like mislaying your keys, and delayed recall of names, dates, and events can be part of the normal aging process, but dementia is not normal aging. Many types of dementia start inside the brain's cells. These include frontotemporal dementia, Parkinson's and Huntington's disease, as well as Alzheimer's disease, which alone is responsible for over 60% of all cases of dementia. These conditions are sometimes hereditary, sometimes not, but there are usually genetic factors involved. Some types of dementia don't start at the cellular level, but in other body systems. The most common type is vascular dementia, which is caused by problems with the brain's blood supply. Vascular is the second most prevalent form of dementia after Alzheimer's. Outside causes can also include brain trauma. This can happen all at once, like in a fall. It can also be the result of repeated smaller injuries, like a series of concussions earlier in life. Sometimes, even environmental factors like toxins can cause dementia. Dementia can be difficult to understand, often because many different symptoms appear at the same time, causing mixed dementia. In these cases, there can be environmental, genetic, vascular, and lifestyle factors all at play at once. This makes diagnosis and treatment especially difficult, since many of the earliest physical indicators of dementia show up in the brain years or even decades before outward symptoms affect a person's life. This can all be confusing. The Dementia Society has more resources to help you understand what's going on. For caregivers of people living with dementia, for people living with a diagnosis themselves, and for anyone who suspects they may be experiencing memory issues. No one should face dementia alone. Our experienced team is here to support you through this journey.